Hello viewers, in the last video we studied about the mediators of inflammation, in which we studied the vasoactive amines, the arachidonic acid metabolites. Today we are going to study about the cytokines and chemokines. So what are cytokines? These are cell derived mediators of inflammation. So cytokines are proteins that are produced by many cell types. Principally the activated lymphocytes, macrophages, dendritic cells, and also by endothelial cells, epithelial cells, and connective tissue cells. And what is their role? They mediate the immune and inflammatory reactions. So this is the definition. Now we already know about two cytokines, tumor necrosis factor and interleukin 1. Tumor necrosis factor and interleukin 1. So we have studied about them while we were studying the leukocyte recruitment to the sites of inflammation. So they play a critical role in leukocyte recruitment. How? They promote the adhesion of leukocytes to the endothelium and their migration across the blood vessels. So what are the cells that produce tumor necrosis factor and interleukin 1? So both are produced by activated macrophages and dendritic cells, but TNF is also produced by activated lymphocytes and mast cells, and interleukin 1 is also produced by endothelial cells and epithelial cells. And what are the stimuli that lead to release of tumor necrosis factor and interleukin 1? These are the microbial products, dead cells, immune complexes, foreign bodies, and various other injurious stimuli. They lead to release of tumor necrosis factor and interleukin 1. Now the release of tumor necrosis factor occurs through the stimulation of the toll-like receptors. Now for interleukin 1, for the production of interleukin 1, the role of inflammasome comes into play. Inflammasome. What is inflammasome? Inflammasome is a multi-protein complex. It is a multi-protein complex. Now the microbial products, when they enter the cell, they are recognized by some intracellular receptors which lead to activation of this multi-protein complex. Now this activates caspase 1. Caspase 1. Now what is caspase 1? It is interleukin 1 beta converting enzyme. Now this converts the interleukin 1, which is in the precursor form, to its biologically active form. So the role of inflammasome is there in the production of interleukin 1. Now what are the actions of tumor necrosis factor and interleukin 1 in inflammation? Both interleukin 1 and TNF play important role in the local and systemic response of inflammation. So what are their major actions? First is endothelial activation. So both TNF and interleukin 1 act on the endothelial cells and they bring about some changes which is called as endothelial activation. There is increased expression of adhesion molecules, P-selectin, E-selectin, and ligands for integrins. Integrins are present on the leukocytes. And there is release of other cytokines and chemokines, growth factors, icosanoids from the endothelial cells. Also, they promote the procoagulant phenotype of the endothelium. What does it mean? It means that they favor thrombus formation. Next is activation of leukocytes and other cells. So interleukin 1 and tumor necrosis factor, they enhance the inflammatory response of neutrophils and they stimulate the microbicidal activity of macrophages. Interleukin 1, it stimulates fibroblasts to produce collagen. Interleukin 1 also stimulates the Th17 response, which induces acute inflammation. Third is the systemic acute phase response. So these cytokines TNF, interleukin 1, interleukin 6 play important role in the systemic effects of inflammation. So these are fever, acute phase reactants, fibrinogen, serum amyloid A protein, C-reactive protein. There is leukocytosis. So these are all effects due to TNF, interleukin 1 and interleukin 6. Now systemic pathological effects. So TNF acts on the heart and decreases the contractility of heart. This leads to the low cardiac output. It also acts on the endothelial cells, as we have discussed, which leads to microvascular thrombosis, and there is increased vascular permeability, which leads to interstitial edema. So all these factors, the systemic hypotension, the microvascular thrombosis, interstitial edema, so they all lead to systemic hypoperfusion, which lead to tissue ischemia, and when combined with the metabolic derangements, this can lead to multi-organ failure. Also, it causes insulin resistance and hyperglycemia. We will again discuss the systemic pathological effects of TNF, interleukin 1, interleukin 6 when we discuss the pathogenesis of septic shock in hemodynamic disorders, and the systemic effects of inflammation. We will again discuss the role of TNF, interleukin 1 and interleukin 6 in fever, acute phase reactants and leukocytosis. Now if there is sustained increase in the TNF levels, so TNF, what is the action of TNF? TNF, it regulates the energy production. So it mobilizes the protein and the lipids for energy production, and it suppresses appetite. So sustained increase in TNF levels is seen in conditions like chronic infections, neoplastic conditions, and this leads to cachexia, in which there is weight loss and anorexia. Now various TNF antagonists are used to treat chronic inflammatory conditions like psoriasis, inflammatory bowel disease, rheumatoid arthritis. So they are used to treat these chronic inflammatory conditions. Now what is the side effect of use of these TNF antagonists? So the patient becomes susceptible to Mycobacterium infections. Why? Because TNF, it stimulates or it favors or it increases the microbicidal activity of macrophages. So when TNF antagonists are used, the intracellular killing of Mycobacterium will not occur. So next we study about the chemokines. Chemokines or chemoattractant cytokines, they are a group of small proteins 8 to 10 kilodalton that act as chemoattractants for specific leukocytes. And what are the cells which are producing the chemokines? These are the macrophages, mainly the macrophages, endothelial cells, and what induces chemokine production? Chemokine production is induced by bacterial products and other cytokines, mainly interleukin 1 and TNF. Now, on the basis of cysteine residues, they are divided into 4 groups on the basis of the arrangement of cysteine residues. They are divided into 4 groups. First is CXC chemokines. In these, one amino acid residue is between the 2 cysteine residues. Example is interleukin 8, also called as CXCL8. Now this is specific for neutrophils. Second group is CC chemokines. Now in this, the 2 adjacent cysteine residues, the first 2 cysteine residues are adjacent to each other. So in this we have monocyte chemoattractant protein, monocyte chemoattractant protein 1. This is also called as CCL2. Eotaxin CCL11, and macrophage inflammatory protein 1 alpha, MIP 1 alpha. This is CCL3. Now these are all specific for monocytes, lymphocytes, eosinophils and basophils. These all are acting as chemoattractant for these cells, but eotaxin specifically act as chemoattractant for eosinophils. Next group is the C chemokines, in which the first and the third cysteine residues are not there. So in this we have, example is lymphotaxin. This is XCL1. So it is, as the name suggests, it is specific for lymphocytes. Fourth is CX3C chemokines. So they have 3 amino acid residues between the 2 cysteine residues. So in this, the chemokine is fractalkine. also called as CX3L1, and this is present in two forms: cell surface bound form, which is present on the surface of the endothelial cells, and soluble form when the protein is cleaved, soluble form. They both act as chemoattractant for monocytes and T lymphocytes. Chemokines, they are found in high concentration on the surface of endothelial cells, where they are bound by proteoglycans, and also in the extracellular matrix. So what is their role in inflammation? So chemokines, they enhance or they stimulate the adhesion or attachment of leukocytes. How they promote the adhesion of leukocytes? By increasing the affinity of integrins, which are present on the surface of leukocytes. And they stimulate the migration of leukocytes in the tissues, to the site of injury, infection, or tissue damage, and this is chemotaxis. Locomotion along a chemical gradient. Now this was about inflammatory cytokines. Now there are some homeostatic chemokines, which are constitutively expressed. What is their role? So they play a role in organization of different cell types. They organize different cell types at specific locations in the tissues or organs. For example, the T cells and B cells are present at specific location or specific anatomic location in the lymph nodes and spleen. So this is done by the chemokines. Now there are certain receptors, chemokine receptors. CXCR4 and CCR5. Now these act as co-receptors for viral envelope glycoprotein of HIV. So they play important role in the binding and entry of the virus in the cells. So now with the help of a table, we are going to revise the important cytokines. So this is a table showing major cytokines, their source and action. TNF or tumor necrosis factor, the source is macrophages, mast cells, T lymphocytes, and the action is endothelial and leukocyte activation, secretion of other cytokines, and systemic effects. Interleukin 1, the source is macrophages, endothelial and some epithelial cells. The action is similar to TNF, but it plays greater role in fever. Interleukin 6, the source is macrophages and it produces systemic effects or acute phase response. Chemokines, they are produced by macrophages, endothelial cells, T lymphocytes, mast cells, and some other cells. So the action is the recruitment of leukocytes to the site of inflammation and migration of cells in normal tissues. This is done by homeostatic chemokines. Interleukin 12, the source is dendritic cells, macrophages. The action is increased production of interferon gamma. Interferon gamma, the source is T lymphocytes, natural killer cells. The action is activation of macrophages. There is inducible nitric oxide synthase, so it is induced, which leads to production of nitric oxide. So this leads to increased ability to kill microbes and tumor cells. Interleukin 17, the source is T lymphocytes and the action is recruitment of neutrophils and monocytes. So this plays important role in acute as well as chronic inflammation. So this was about cytokines. In the next lecture we will be studying about the complement system and some other mediators of inflammation. I hope you liked the video. For more such videos, please subscribe my channel and do not forget to like and share my videos. Thanks for watching.